Hi guys, welcome to my 29th week pregnancy vlog. I will share with you my 29th week, some new purchases, some ongoing symptoms, and also something that happened today, which is technically my 30th week, but I have lots to share with you for next week's vlog and my 30th week, as I'll be having an ultrasound. So I'll just include today's episode in this vlog. So the 29th week has kind of started off pretty slow, really not a whole lot of new issues, and that's pretty uneventful, and I'm perfectly fine with uneventful, because usually, no news is good news. Really just some ongoing symptoms. My sciatic nerve pain has been ongoing, which is really not too bad. But also there's another symptom that I have had probably for the last at least 4 or 5 weeks that I don't think I've mentioned on here before is the heel pain that have. And I'm not sure, I looked it up, and I'm not sure if it's just like weight gain or what is causing it, but I cannot stand without shoes on in a flat surface. I can't just stand there. Walking is fine, but standing is very painful on my right heel without any shoes on, so I have to wear shoes constantly, and I've been trying to wear really supportive shoes, like tennis shoes and things that have good arch support, and I've been wearing my bear paw boots, however, though, because it's been very, very, very cold here lately, like the negative 15 to, I think, yeah, the low was negative 15 today, so it's been crazy cold. So I don't think those are the best probably to wear, but they're very soft. They feel like you're sticking your foot in a marshmallow. They're basically like the Uggs, like a knockoff of Uggs. But that's kind of been something I've been dealing with, but not really too bothersome. I just put shoes on. Another thing that has been bothering me, which is really starting to get bad now, is how many times I wake up a night. Normally, probably since the second trimester, maybe around 20, 21 weeks, I have been waking up quite a few times to use the bathroom, which I know is normal for pregnancy. As the baby gets bigger and starts pressing on your bladder, that's pretty normal. However, now I'm not just waking up for that, I'm also waking up very uncomfortable. As most people know, that you're not supposed to sleep obviously on your stomach, and you're also not supposed to sleep on your back, which I didn't know previously before I started reading the pregnancy books and things like that. Apparently it cuts off blood flow to your heart and to your baby, and you don't want to take any risks. And unfortunately, where I like to sleep is on my back and my stomach. So if anybody asked me what I really miss, it will be sleeping on my stomach and my back. I will be looking forward to doing that again when I'm not pregnant. But, just one of the wonderful joys of, pregnancy, and it's all worth it with your little baby once you get to hold them in your arms, I'm sure. But just kind of a thing that has been, hard to deal with, is getting less sleep and just feeling uncomfortable when I'm sleeping. I kind of dread going to bed. But that kind of brings me to today's little event, I guess. I woke up this morning around 5 a.m. with some cramping in between my hip and my pelvic area, and it started off as just like a little cramp, and then I got up and it felt like I had like a Charlie horse there. But it didn't go away. It was so painful, like the worst pain that I think I've ever felt, just absolutely horrendous, and it was not going away. I was walking around, I was massaging it, my husband tried to massage it, laying down actually felt worse, and then, I was thinking about calling labor and delivery, but I was trying to, kind of wait it out and see if it would go away, but, my husband, who is actually normally, he doesn't sugarcoat things, and he's kind of like a, suck it up and you'll feel better type of person. Well, he saw the look on my face, and I was quivering and I was nauseated, and, he's like, you need to call, or you need to go down there. I'll take you down there. So I ended up calling, and the labor and delivery nurse after explaining my symptoms, didn't seem to think that it was an obstetric issue. So she recommended I call my on-call doctor at my clinic, which I did. While waiting for the on-call doctor to call me back, the pain started going away. So this has been about half hour or so maybe with the pain, and it finally started going away, just kind of faded it away. So as she called me back, I explained the situation, and that, of course, the pain had gone away almost completely at that point, which is good, but, that's just how it always goes whenever you call. It goes away. But she recommended either that if the pain comes back, go to labor and delivery, because ER will just send you there to make sure you're not contracting, which I didn't think that I had been, because they weren't consistent, and it was not not in the center or on my stomach. It was in a kind of a strange spot, or she said, she does want me to get checked out by my regular doctor today. So at that point, it was still too early to call my clinic. So I called into work, and I told them what was going on and that I might be back later, depending on what the situation was and how I felt. So I waited for my clinic to open. My husband went to work, and I finally called them at about 8:30, and they said I should come, or they wanted to make an appointment for me to come in. And I said, well, I would like to, pass the message on to the doctor first about my situation, because I do know that, and I've been told this by my doctor, that she can't do too much if there's an issue without sending me to labor and delivery first, to make sure that it's not something more serious, or that I'm in labor, anything like that, because she doesn't have the equipment to test there. So I wanted to make sure before I wasted her time and my time with an appointment. So she actually wasn't there. So they transferred me to another clinic, and I talked to the message center nurse there, and she, was going to get back to me. So she finally called me back about 10:30, and she said, yes, come in today. And I made an appointment for about 2 p.m. And then they called me back probably about 25 minutes later, and they're like, no, Dr. Barrow, she's my doctor, she said she wants you to go to labor and delivery. And I said, even though I'm not having the pain anymore? And they said, yes, please go. So my hospital labor and delivery unit prefers that I call before I go down. I'm sure they're probably pretty much all the same like that. And so I called them again, and of course I got the nurse that saw me last time, and I was not her biggest fan, or she wasn't my biggest fan for sure. She just kind of was like rough around the edges, and she wasn't very comforting. I don't know, there's just something off about our chemistry. I didn't feel comfortable around her, and of course she was the one who answered the phone, and she was asking me the questions, and I don't know, I didn't let that put me off from going down, but I did feel like she kind of felt like I was stupid for coming or calling again, and I don't know, I feel like they should, be really, I'm sure they go through a lot, but I kind of feel like they should be more understanding, because, when you're a first-time mom, you're scared, you don't know, your doctor tells you to call. I mean, it's just, I don't know, you want to feel welcomed. I mean, that's where you're going to be going through this tremendous amount of pain, and you're going to be delivering your baby, and you want to feel safe and secure, and, I know that's just one nurse, so anyways, I digress. I did go down there, and thankfully, she was not my nurse, and I did have another lady who was perfectly fine, and they monitored my son's heartbeat, they monitored my stopped my uterus for contractions, and I was not contracting, and his movement was very good. He was moving all over the place, and in fact, like, you could hear, like, in the monitor, like, the little, every time he moved. He moves a lot. So thankfully everything was fine, but it did kind of put me off a little bit to the hospital that I'm going to be at. I know it's just one nurse, and I know that I can request another nurse, but I don't know. It's just not the kind of experience that you want to have, and I certainly don't want to be the person, who cried wolf, and I don't want to be down there all the time. I really don't want to be that person. But what do you do when you have an ache and a pain, and you're concerned and you don't know, it doesn't seem to be a typical thing? What do? You call your doctor, and your doctor tells you, you go down there. But yeah, that was my experience today, which is good and bad because I am fine and the pain is gone, but I do feel a little bit of anxiety as now labor, the thought of labor, it gets closer, and knowing that you don't feel perfectly comfortable where you're going to be giving birth at, and also the pain that I felt, like, if that's even, I'm sure that's not even a drop in the bucket to what it feels like to have, labor pains, but that was absolutely horrible. That was horrible. So now I'm starting to get a little nervous about that, and I wasn't really that nervous about labor, but whatever, it's all going to be worth it in the end, and I'll get to see and hold my beautiful son, and it's just going to be, all worth it in the end. So now I will go ahead and share with you some things that I purchased, and also something I made. So today, actually, after labor and delivery, I went to the Goodwill because I knew they had half off items, a certain color. So I did go and I bought a couple of things for baby. I wasn't really planning on buying anything like this at the Goodwill, but I just thought it was cute, and it'd be nice to have like an extra blanket. I got this cute Winnie the Pooh quilts. You can kind of see there. And then the back side also has little Winnie the Pooh scene on there. And it looks like it's brand new. It doesn't appear to have any stains or anything like that. I checked it over, and it was only $1.99, so that's a good deal. And it's, with babies, you can never have too many blankets, and it doesn't exactly match the kind of bedding that we've picked out, but babies spit up and all kinds of stuff over it, so it's always good to have an extra one. I think Winnie the Pooh is very cute. I don't have the other thing here. I must have left it in the hamper because those need to be washed. But anyways, I did get another cute little Winnie the Pooh hat, and it actually kind of matches that, but I found them in separate areas. I don't think they were meant to go together. And it has like the little bear ears, and it's blue. It's super cute, and it was $1.99 as well. And then, excuse me, I stopped at Target sometime during this week. I can't remember which day it was, and I got this Hyland teething gel. I just happened to see that on the clearance aisle, and I've registered for this. I've been recommended this by quite a few moms that I know, and it's really good because it does not have, the typical medication numbing gel. It's like a pretty natural, I don't want to say it's all natural, but it's pretty natural, and I try to use natural products whenever I possibly can. And it was on the clearance aisle, but it doesn't appear to be expired or used, so I always watch out for that with anything like that on the clearance aisle when it's this kind of a product. So it's a good deal, and now I can take that off my registry. And then I also did get this hat, which I think I got a while ago, but I forgot to include this. This was another Goodwill purchase, and it's a sun hat for, out in the pool, and it's got that kind of material that's waterproof, and it's just really super cute. It's got a little beach scene on there, and I think I told you guys in my last video, or the video before last, how I just kind of have this vision of taking my son outside in the sun and to the beach and the pool, and especially with this cold weather, I'm just really thinking about that kind of stuff. It just makes me warm my heart a little bit. And then I got this from H&M. I had to return some shirt that I got there that was not quite fitting right. And I got this cute little white, just basic sun hat, little play hat to be outside. And it was $3. And then I also got these little cute sunglasses with little Cookie Monsters and Elmos on it. Now these look big, so my plan was for him to wear these two together, but these look like they're probably for toddlers, but that's alright. He can use them when he's older, and this was $5.95. I did look in their baby clothes section, and I wasn't that impressed with their stuff. It was kind of whatever. I'm also trying to hold off on buying clothes because I know that I'll probably get a lot for my shower, and I also don't know what his size will be, how big he'll be, and you know, you gotta buy for the seasons here, especially where I live. You know, we have all 4 seasons for sure, so you don't want to plan too much ahead because things can always change. And when I think he's 6 months, in 6-month clothes, he might actually be 3 months old. So finally, the last thing I have here to share with you is probably something I should have saved for the nursery thing, but I was just so excited, and I was kind of proud of myself for being crafty and making these. Were these painted letters for his name in his little section of our room. They're going to be hung up with these little bows. Oops, sorry, that way. I gotta cut that glue off from the hot glue gun. But this A has like brown dots and little blue dots, and you know, the other ones are pretty simple. This little M, again, has the bow. Oops. The bow here. And then the I, just like a light blue one. Nothing too special. And then the R has the little polka dots on it. But I think that'll be really cute all together, and just kind of pull his area of the room together and make it feel like he actually has like a separate section. So yeah, I'll show you around once we have that set up. We have not purchased any of the big items like I want to. However, we will be doing that for sure by the end of the month, and once I have that up, I will show how we're going to arrange that once we've got that figured out. Because time is ticking, we need to get moving. So now I'll go ahead and show you my bump here. So I feel like it's getting so big, but I guess I should say that every week. Yeah, I feel it's pretty round too. I feel like he's kind of spaced, evened out. Before he was like on one side. Now I feel like he's just right in the center here. But yeah, that's really all I have to share with you, and I appreciate anybody who will come across these vlogs and watch them, and anything I can do to help you, and any questions you have, please feel free to write me a message or a comment. I just really enjoy doing these videos. Thank you.